Hello, I am Dr. Arjun Handa, plastic surgeon at Handa Aesthetics Plastics. In this video, I want to talk to you about thigh liposuction. What is this procedure? Who is the ideal candidate for this procedure? What are the problems that thigh liposuction can address? When can you see the result, and what is the post-operative period like? So to start with, who is a good candidate for thigh liposuction procedure and who are the patients who look out for this procedure? Most of the patients who look out for thigh liposuction are predominantly females. They usually have a problem that most of their fat is accumulated in their thighs in proportion to the rest of the body. There is a very specific problem known as lipodystrophy, which is very common in thighs of females. Also, it gives their thighs to be like a barrel, and then they have thin calves. So it overall gives an appearance of an inverted champagne bottle. So when they look at themselves, their main complaint is that our waist is narrow, our arms and upper body is narrow, but when we wear jeans or something like that, it usually doesn't go with the rest of the body because there is just too much fat in the thighs. And because there is too much fat in the thighs, they also have a complaint that then when they're sitting or standing or walking, the inside of the thighs, the skin rubs with each other, creating a lot of problems with them, such as maceration and rashes. And over a period of time, it can become very painful also. Apart from that, they also feel that there is a lot of pressure on their legs, and they usually get a lot of cramps while sleeping in the night or sometimes after waking up in the morning. So these are the complaints that people usually come with. There is a very specific complaint of some older females that they usually have excess fat deposits in their hips, that is on the side of the thighs, which usually becomes like a lump, and normally what we call it as saddlebag. So this is called as a saddlebag deformity, where there is an excess deposit of fat on the sides of the thighs. So these are the usual complaints of people who come for thigh liposuction specifically. Otherwise, thigh liposuction is also routinely combined with liposuction of the tummy and the lower back, or sometimes thighs liposuction is combined with liposuction of the calf as well. Next, who is a good candidate? So with respect to thigh liposuction, any person who feels that there is excessive fat on their thighs and has a decent amount of skin quality, that is, the elasticity of the thigh skin is not too bad, they don't have a lot of stretch marks, are a good candidate for thigh liposuction procedure. But if the patient feels that they have a lot of cellulite on their thighs, not too much fat but cellulite, and they feel that liposuction can get rid of their cellulite, then sadly that's a misconception. Liposuction is not a treatment for thigh cellulite. Thigh cellulite may or may not improve after liposuction because it is not a defined or described procedure for thigh cellulite. So only if you have excess fat and good skin quality are you a good candidate for thigh liposuction procedure. Normally when I am assessing my patients for liposuction, I also assess their body mass index. With respect to thighs, this does not hold true because in majority of the patients I see, their body mass index may be on the higher side, but even then the amount of fat deposited in the thigh is disproportionate to the rest of the body. So whenever I am examining thighs, I examine them as an individual area unless and until the patient also wants me to do something for their tummy and lower back, because then I have to consider the butt, the hip, thigh, tummy and lower back all together to give them a nice figure. Finally, how is this procedure done? This procedure is done just like any other liposuction procedure. We make small holes, we emulsify the fat using razor, and then we suck it out. It's usually a daycare procedure in that the patient comes in the morning, gets it done, and by the evening they are ready to go home. In the post-operative period, the patient may have some pain, which is usually 5 to 6 out of 10. This will last for about 7 to 10 days. It is usually like muscle cramps that you get after going to the gym. It's like the same quality. And then apart from that, patients are going to have a little bit of swelling, which is usually going to disappear in about a month by about 70 to 80%. For the same reason, in the post-operative period, the patient has to wear a compression garment. They have to wear it for 24 hours a day for a month to limit the amount of swelling. Another mandatory requirement in the post-operative period is lymphatic drainage by a physiotherapist. These are gentle massages which physiotherapists do to help you with the swelling and pain, and also make the result smooth and absolutely beautiful for the patient. So this is all about thigh liposuction. If you want to know anything more, you are always welcome to mention your questions in the comment section, and also to directly call us or to leave a mail at our website. Thank you.